Hi, I'm Melissa Stocky, a nurse injector at Cynthia Gregg, MD, Face and Body Specialist.
I'm Megan Barrio, nurse injector here as well.
So today we're going to talk about Sofwave, and we're really
Yay.
excited for it. Sofwave is our newest modality for skin tightening and energy-based treatment. We've had all therapy, and we've done that for years successfully. All therapy is also ultrasound-based, heat-based, but the Sofwave is going to be for really fine lines, areas of skin tightening like the jawline, under the chin. We can actually provide like a brow lift from
Hmm.
it, which is beautiful. And also the neck. The neck is a huge area where we start to get crepiness, and patients will have their face
Yes.
beautiful, and the neck will start to age. And
Well, and I was gonna say, starting as early as our 20s, we
Mhm.
start to lose collagen and elastin in our skin, and it continues that wonderful aging process. But this actually helps us to reboost that collagen and help give that nice tight look that I know a lot of people really want.
Yeah, and the beautiful part about Softwave is we don't have downtime. I mean, it's virtually
No.
zero downtime, all skin types,
Hmm.
all times of year. The prep for it is just numbing prior to your appointment. We will have you start an oral vitamin C just because we've done that for years with all therapy, and studies show that it helps with this neocollagenesis, which is what is new collagen cells, and that's what Softwave will provide. So we really like that we don't have any limitations as far as skin type,
Right.
time of
Right.
year,
Hmm.
downtime. We have busy professionals who
Yes.
can get it
Yes.
done with an hour or less and return back to work and not have to worry about bruising or swelling or inflammation. The
Right.
day of, how would you describe the day of, Megan?
So I would say day of, we want you to come about an hour prior to the procedure. That way we can get some photos and we can go ahead and get your numbing cream
Mhm.
on. For pain management, we want you to be as comfortable as possible. So we have options of doing the Zimmer cooler, which is like a cooling machine during the procedure. We have Pronox, and then we also can get some Motrin on board for you as well. For comfort, we want you to be as comfortable as possible during the procedure and be able to do as much as we can to get you that best result.
Agreed. And patients with this procedure, with the soft wave, are seeing results as early as 1 to 2 weeks because of the heating mechanism. So they're seeing results earlier, which is quite nice. Also, it should be noted that this procedure has a cooling mechanism. So we heat the skin to 1.5 millimeters in the top layer and into the dermis. And what happens is immediately after, there's a cooling phase. And what that does is protect the skin. So it's unlike lasers.
Mhm.
This is going to be energy based, and it's quite nice to have that heating and that cooling phase.
Right after,
Yeah,
exactly.
and so patients are really enjoying the procedure.
Mhm.
With the Pronox, I think it should be noted you don't have to have a driver with
Correct,
that.
right, good
Yeah,
point.
so nitrous has been quite nice.
Yes, and so a lot of patients, you can still get comfortable, but you don't have to worry about having a driver take you, and you will stay after the procedure about 10, 15 minutes, would you say,
Yeah,
just to
15.
make sure you're doing well and ready to go. But minimal downtime, you'll finish or continue your skincare routine that evening.
Yes.
Patients will talk about maybe a windburn or a sunburn feeling of tightness, usually for the rest of that day.
Mhm.
But that's about it. You could go out that night and
Mhm.
wouldn't know any different. So it's really nice.
Yeah, and I think it should be noted also, this will not be taking the place of all therapy. We've used all therapy here at this practice successfully for many, many years. We're very used to these ultrasound-based modalities. So this is just another tool in our tool belt
Yeah,
to
exactly.
use for patients. It's going
Mhm.
to be based on the assessment. So you can set up a consultation to determine if soft wave is appropriate or all therapy. All therapy will still be for patients with that real thick, like doughy jawline or the jowly area that we would need to go a little bit deeper with energy-based modalities. But
Mhm.
we're really excited about it. Patients are loving it.
Yes,
Yeah. So.
absolutely. And not only for patients that are coming in new to the practice, but patients that have seen Dr. Gregg and have had surgery.
Mhm.
It's great for keeping the longevity of your procedure done. And
Absolutely.
so that's really nice. And then also for our younger group, you can have this done as kind of a prejuvenation,
Mhm.
storing collagen, storing up your collagen bank and getting you ready for down the line. It's another great method to use for that too.
Agreed. I think lastly, the difference with the soft wave versus the alt
Mm.
therapy, one key difference is going to be the beautiful medial brow lift, the brow lift that we can provide with this mechanism. Soft wave procedure, when we treat above the brow, we have techniques that we use, but we can actually give you a little subtle brow lift. And who doesn't love a brow lift?
Right.
So,
Just opens up that
yeah,
face, looks so much better.
it's really exciting. So thank you so much for joining us today for the Patient Appreciation Day. If you have any questions, our emails are below as well as the office phone number. You can call and set up a consultation to determine if you're a good candidate for Sofwave. Thanks. Bye.